Welcome to the Dr. John Char Holistic Health Show. In the last show, we talked about cell metabolism and how important that cell wall or the cell permeability was. Today, we're going to be talking about the pulse electrical magnetic field. It's a PEMF. It's called pulsed electrical magnetic fields. And why so important now? We're living in an age with biotechnology, and we're going to be showing you how we've lost a lot of the energy from the environment and everything that we live in, and all the EMF, electromagnetic fields, are being depleted. We're getting what we call electrical smog coming in, and it's dousing. It's the pure electromagnetic frequency that we should the body is happy to receive. Okay, so when that happens, I told you that if you can't get into the cell wall itself, then your cells start to die. So that's why it's important that we talk about it. And now we see so much in my practice, a lot of people, when we do a scan on them, we find out, look, gosh, the ATP is down, the mitochondria is down, they have very low cell potential in the cells, and they're getting tired, and the cells are dying, and they're picking up all kinds of disorder and diseases. And we see early stages, when we scan them, we see early stages start to happen before they actually see it in the blood test or the urine test, okay, or the other test they're taking. Because if you do see it in that test, then you know you already got the pathology or diseases. So we got to be smart, and we have to go and find out if these are in its early stages or intermediate stages where we can actually recognize it, we can slow it down or stop it and reverse it back to as much as possible to its normal stage. And a lot of people will have these things happening in the body, especially those who are diabetic too, which is 1 out of 3 Americans are now getting it, especially in Hawaii, pre-diabetic too. So what happens is, if we can detect that and we can show people how to energize their body, the body is going to feel better, and you're going to also slow down, especially your shut-in people, slow down the aging process, okay? So we're going to be talking about what is PEMF, the whole body battery recharger. Okay, so PEMF is called pulse electrical magnetic field. Pulse electrical magnetic field. Okay, so it acts like a spark, ignition, or impulse that keeps the cell of your body charged at an ideal voltage or energy level. And your body has 70 trillion cells, are like miniature pumps, transferring oxygen, water, and nutrients. I call it sometimes substrates because it comes from the blood, into your cells, and waste products out of which it releases out of the cells as waste products, which requires energy to function. Now, for instance, what happened? The Russians won the space race with Yuri Gagarin's history flight around the Earth. But when he arrived on Earth, he had depression, bone loss, muscle degeneration, and decreased metabolism and impaired perception. Since the historic flight, zero field studies have confirmed that if a living cell do not receive the pulse magnetic fields of the Earth, they will die within a few hours. So it's really vital for life on Earth, including the human body, to get that energy, that pulse electrical energy, electrical magnetic energy coming in. Now, like I said, we live in a world of electrical smog or dirty electricity. How do we get that? We get it from the power lines, are computers, cell phones, digital clocks, microwaves, TV, Wi-Fi, Bluetooth, hair dryers, and so forth. These are unhealthy energy that block the natural frequency from the earth that are vital for life. And so everybody's well worried about the cell phones and the electromagnetic frequency coming from that. And of course, the industry is going to say there's nothing wrong with that. And yet there are people making devices that they use to kind of buffer out the electromagnetic frequencies. Some studies have shown that the people who use a lot of their cell phones and everything are now forming some tumors in the head. Okay. While we always go outside to get nourished with the sun's rays and get energy from the earth, over the past 300 years, the Earth's magnetic field has declined to 50%. So we theorize that we are in a process of pole shift over the next couple of thousand years. On top of that, people spend too much time indoors and insulated from the Earth's natural fields. So why do you go all the times you're indoors and you feel chill and you feel tired, and you go outside and you feel regenerated, revigorated, okay? Because you get that ray from the sun, the solar, and you got these energy coming around. But now it's getting less and less because we have so many different electromagnetic field disturbances in the environment. So we're going to see if we can increase that energy. So in a clinic, we get all kinds of contraptions. They call it contraptions. That's why my wife calls it contraptions. And there are a lot of these equipment is called bioimpedance. It works on bioimpedance. We pick up resistance in the cells that are trying to protect the body, and this resistance, and what happens is the cells are dying because they overwork. Now, the electromagnetic frequency we talked about, everything I mentioned there, is depleting of cellular potential, okay? And it's causing problems with even us intaking supplements and food. Even people who exercise are still getting tired, or they're still getting drained, okay? So now we got to be smart. So we have to put back into our body what has been depleted from all the different technology we have in terms of living in this century right now. And so we have invested into a lot of research to find out how we can put these energy back and hold that energy in your body so then you can have good days. Now, I'm going to tell you some of the things that we talked about, getting the cells being charged with these electromagnetic frequencies. Okay, we're going to show you the slide right now of a cell again. Okay, now we showed you this. Now here's a cell, and you can see right outside it's the pluses, usually potassium ion. Inside is sodium. You see all the minuses. And we talked about the cell membrane in my last show, how the food or substrates or nutrients can get into the cells and everything. But this cell has to be energized. It cannot be lacking the cell potential, because what happens is that if it does, this cell will die. You cannot live without the cell potential. But it has to be very low, and it has to be magnetic, okay? Kind of electromagnetic and more magnetic, because we're losing that in our Earth's atmosphere. Not atmosphere, but Earth, rather, okay? So you can see this here, all these different molecules out there, and right now it's going in and out. So what it goes in is the minerals. We want to get the minerals in there. We want to get the nutrients. We want to get the oxygen in there so these cells can start to work. But out comes the water, out comes the carbon dioxide, out comes the toxins, and it has to go back into the bloodstream to be released through the veins and out to the thoracic, out to the body. Okay, now getting back to this. So we have looked into all different types of equipment, okay? We have gone through looking into different types of equipment. There's so many different equipment. You go onto the internet, there's everybody claiming we got this equipment, that equipment. Okay, we're going to shift back from the slides to me. Okay, good. And so we have to go ahead and start to be smart about this. But you know, when you buy all these equipment, you can buy all kind of equipment. Everybody makes this claim through light therapy. You see that, lasers. You see that magnetic therapy. People are now wearing all kinds of gadgets, like I said, devices. They wear the things around the wrist, which is magnetic. They run around the neck. They run around different parts of the body. They put beads, stimulating acupuncture points, which is like electromagnetic current going through. It's a pulse. They're using now equipment, all kinds of things to get the body charged up. Okay, so now we have looked at high technologies because our practice do high technology. So we use a lot of high technology. I'm going to share that with you. Okay, so it's like recharging the body's battery. The battery runs down, the cells start to get slowed down, cell metabolism starts to suffer, and of course you can pass away, the cells can pass away. So researchers show some evidence of improvement by using these low frequencies up to 30 hertz now. Okay, we're not talking about light more or less, but we're talking about magnetic therapy. And we worked on Alzheimer's. Okay, and Alzheimer's, they've seen by research and double-blind studies that it has increased the visual memory and visual constructive factors in Alzheimer's and also dementia patients. I make a standing joke when I have my seminars, and I says, look, how many people have gone to the next room and forgot why they went there? And everybody laughed and they raised their hand. It's like a joke, but it's not a joke. And just because you're getting older doesn't mean that you should lose your memory. It's the environment we have to protect ourselves with, and if we do the right thing, we can still have a good memory. And all the supplements you take, it's got to get into the cells and work. And without that current going through that, you're not going to be able to efficiently get that in there and make the body respond and work better. So Parkinson's, they found out that they have done with 5 to 8 hertz. Okay, and let me tell you about the hertz. The hertz are real low. It can be up to 30 hertz. That's the Earth field. That's all we need. And people say, "Well, I'm using a lot of hertz," and really, you can go up magnetically up to 30 hertz. And if you use low hertz and you know the right frequencies, then you can get the cells and certain cells to work. And one in the brain is Parkinson's disease. And they found that the cognitive or awareness rehabilitation is improved dramatically by using to 5 to 8 hertz. Okay? So, how about ankle sprains? How about it reduces the edema? They can use it for soldiers who have injuries in the field and have swelling. They found within 1 day the swelling has gone down dramatically. Okay? It's called edema. Chronic back and low back pains, they've seen the amount of healing and amount of the pain reduced dramatically within less than a week. All right? Osteoporosis, okay? They use 72 hertz, okay, and 10 hertz daily for 12 weeks and found that's a prevention and treatment for osteoporosis, okay? Bladder cancer. Wow, they found that this enhanced T cells activity, and they had a higher T cells and beta lymphocytes and higher CD4 plus and CD16 cell level, and also increased T cell activity. Okay, so they also can be used as anti-stressors. So for the bladder cancer, and they also now finding out that in some cases they can use that as a substitute for drug therapy. So people want to get off the drugs, they can go towards this technology, okay? And it will help the immunocorrection to avoid the recurrence of the bladder cancer. Breast cancer, you found out that people with lumps, tumors in a breast, and they found some pretty good double-blind studies where they seen a major improvement and removal of those tumors. Interesting. Okay, cancer cells, it can be used as an adjunctive for treating malignant tumors. Now, when you have a malignant tumors, you got to do surgery, chemotherapy, radiation. Now, they have been using this as on a double-blind studies and found that these significant amount of patients, they didn't have no adverse side effects, and it created an anti-tumor effect. And used as a preoperative, before you for breast cancer, was highly effective with shorter and less extensive post-operative lymphorrhea. Okay, so now how about carpal tunnel syndrome? People with the wrist problems, and they say, well, I do a lot of this manual work, and my wrist is hurting, and a lot of them, they say they can't get results. They get surgery. It's because you see the median nerve goes right between we call this ligament called the retinaculum, and it tightens up, and you start losing the function of your fingers, the strength of the fingers, okay? And it's painful. So, they found that it is, they have a significant long and short pain reduction. What about your cartilage? A lot of people talk about cartilage. Excuse me. Cartilage, severe joint inflammation. Okay, how about these athletes? They get a lot of cartilage problems, right, from injuries, especially the knee. Okay, and ligaments and cartilage. Okay, so they get severe joint inflammation from trauma. So even with orthopedic or arthroscopic surgery or infection is reduced, that from the surgery and the arthroscopic surgery, the infections are reduced to prevent further degeneration of the cartilage. How about dental pain? That was my area, dental pain. I've been a dentist for 47 years. I practice as a holistic dentist. And we're always looking for things to reduce the pain because, a lot of patients have pain, and sometimes they say, how come I got this bizarre type of pain, right? And a lot of times the bizarre type of pain wasn't actually from the mouth. It was generated from a remote site. Could be a joint, could be a muscle, could be different organs that's related, linked into the teeth. And if you took an X-ray and you did your diagnostic and you examined the teeth, you couldn't find anything wrong physically because that's what you're looking for. But then it was energetically, and yet when we actually balance the remote related organs or muscles, all of a sudden the pain went away. Oh, wow. Was it a miracle? No, because we understood the relationship of all the parts of the body, and teeth seems to be one of them, okay? So with dental pain, if we put the right frequency in back, because you can remember now, going back to the tooth has different frequency coming in through the acupuncture meridians, but also you have a nerve going in there, right? And the nerves have certain impulses going in there too. And so if it's changed, it's inflamed, you're going to get sore. So usually that frequency is really high. And if the frequency is really low, then the tooth starts to die, you see. And so therefore, you have different variation of pain. So by balancing that out, you can get rid of a lot of dental pain. Okay. Now, getting to more common things in our health is called diabetic neuropathy. You've seen a major improvement in peripheral circulation. And we see a lot of people with peripheral circulation, and usually in the hands and usually in the feet. Now, people with varicose veins or spider veins, they have circulation problems. We all know that, okay? And the veins doesn't have any valves. The arteries don't have any valves. The veins do. It's like valves. And so as the blood comes up, the leg coming away from the organs or returning back to the heart, it goes up into like sections and have valves. And the valve shuts it so it don't back up to it. And then what happens if it's weak there and the thing starts to seep, then the vessels, the veins in our legs get engorged with blood, and because it's kind of close to the surface, you see an ugly looking varicose vein. Okay? And sometimes you see spider veins, small little fine spider veins. Now, what do? Now, if you strip it, that's one of the ways they do it, they strip it. Okay? What did? You still got to have the blood come back, and you might go to another one and you cause the same problem because you didn't improve the pressure coming in. And those people, their feet are hurting anyhow. They're tired, okay? And so to get that blood out, you got to step on your leg and your foot, and then you have to drive it up to your calf. And that pressure brings it up, but also the adrenal glands also push. So if you're stressed out, how in the world you can get that blood back up there, back to the heart? So it stays engulfed there, and you get swelling there too, all right? And that's called peripheral circulation, peripheral vessels. You can also in the hands, but not so much in the hands muscle, but in the feet. Why? Because there's gravity there, okay? And so you have gravity there, and of course, what also can contribute to that is the electrolytes, because electrolytes give you sort of electrical current. Okay, they give that ionization of the minerals, all right? So you can look at that, and then you say, oh, my kidney's not doing it. It's building water for aldosterone. Guess what the aldosterone is made? Where it's made? In the adrenal gland, and the kidney regulates that to control water, all right? If the water is not functional, your body starts picking up with fluid. And so these people are now getting diabetic neuropathy and it's going to a diabetes 2 situation. If you don't take care of that, guess what? Then you're going to end up with, can lead to diabetic 1 and or can also contribute to the cardiovascular problem, the heart problem. Why? Because the blood has to get back to the heart, right? Okay? So it's really important that we understand that. So we need that current in the cells to get moving, or else we can't get the body to function well. It's a big thing right now. A lot of men, they're going into a certain age group, and they say, after you're about 70, you start losing it sexually. And it's called erectile dysfunction. And what's erectile dysfunction? So they take this Viagra, which has all the different nitrates in there, increase the blood circulation, dilation, and guess what? Some of them don't work, right? They don't work. So they try one and try another, and they even have specialists that do that, but they go on drugs, okay? So they said that they seen an 87% improvement of 116 patients from the age of 20 to 60 years old, improved by increasing the cell potential of the cell, okay? The pulse electromagnetic field, getting that in, and it would help. So that's pretty neat. Imagine doing it without any drugs or any additions, okay? To stimulate your circulation in your sexual area. Okay, how about those people who suffer from fibromyalgia? Wow, inflammation. Okay, they also use it for fibromyalgia. They use it for, guess what? Inflammation that creates psoriasis. That's tough. Psoriasis is a tough thing to cure. There's no cure for psoriasis, what they say. They do it for arthritis, knee pain due to osteoporosis, lumbar fusion. That's interesting. Migraine headaches. They use migraine headaches, and they said they help them in less than 3 weeks. Multiple sclerosis. It relieves the symptoms of the multiple sclerosis, the chronic, mostly chronic tiredness. Again, I told you about how chronic tiredness happens. Can't get the nutrients into the cells, okay? and chronic fatigue. So these are really important things that we should consider. And now, I hate to be someday, we got to use machines, we got to use this. But this is biotechnology. How many times have you gone to a hospital and they tested you, and most of the equipment right there are from computers. Everything practices computers. It's high technology. We live in high technology. So find someone who can do that and help you with that. And perhaps it can even reduce the supplements you take. And if the supplements you take is going to be working more effectively, efficiently for you, and you're going to feel better. Okay, so now, again, you can go back to our Wednesday show and look at the Wednesday show now. It's viewed on the first and third Wednesday of the month at 6 p.m. on Channel 52. And you can go to my website. It's called www.drjohnchar.com. Okay, you can look at my Facebook. You can look at my YouTube. You can look at my Twitter. You can look at my blog. I'm found on iMobile, fan page, and Google. You can find all these things on me. I'm right there. Okay, and the more we give you information about how you can keep yourself healthy, that's what we like to do. Give you some tips on how to stay healthy for a long period of time. Longevity and wellness is our motto. Okay. Well, so next time we will see you in the next show, and we'll come up with some more helpful tips.